This describes a specific technique for accessing the knee joint to allow surgeons like myself to perform both from simple to complex operations on the meniscus, which is the shock absorber that sits in the middle of the knee. Arthroscopy is the fancy medical word for keyhole surgery. So some patients have heard of, well, many patients have heard of the option of having keyhole surgery. So arthroscopic meniscus repair is being able to perform that, what I feel is very necessary surgery via the keyhole method. Performing it via arthroscopy has really transformed the recovery for patients. So keyhole surgery allows you to access parts of the knee that are not necessarily so easy to access via other methods. But because you're not opening the whole knee joint, the patient's recovery is a lot faster. So it's been a very useful adjunct to allow us to perform sometimes complex surgeries, but in a way that allows our patients to recover faster and do what we all want, which is get back to living their life the way they want to sooner. So meniscal tears come in a variety of types. The most common tear is actually caused by the aging process or general wear and tear. And actually most of those tears probably don't need surgery for repair. In recent times, both our techniques and the specialized equipment that we have for performing meniscal surgery have improved. So we're now able to repair more menisci than we were, say, even 5 years ago. So this procedure is commonly performed in the younger patient age group, but as I just mentioned, with the advances in technology, we're now pushing the envelope and trying to repair menisci in patients who previously would have been left. What's the advantage of this? Well, the meniscus is a very important structure for distributing weight and load throughout the knee. And once it's torn, it tends to lose that function, and that can lead to the early development of arthritis. So if you are able to repair a meniscus and restore its function, then it does appear to be rather protective for the joint of that patient. Keyhole surgery for the meniscus is normally a day case procedure. So patients are going home on the same day. Depending on how we've done the repair and what type of repair it was, it's common for the weight-bearing status to be limited to allow the surgery, to allow the meniscus to heal after the surgery. So it's not uncommon to have either partial weight-bearing or non-weight-bearing for between 4 to 6 weeks after surgery, but it does vary from patient to patient. You can be very functional with that, and most patients are functional with that from a very early point in time. But full recovery to activities that put the meniscus under stress, such as deep squatting, doing heavy weights in the gym with a very bent knee, that is usually well beyond 4 months for the more difficult tears. So it does vary. Patients get home quickly, but the longer term recovery under the supervision of a good physiotherapist can be a few months. I think very much so. Meniscal repair is becoming a more common technique for trying to protect the joint and to try and limit or improve the function of the knee and stop it from becoming arthritic relatively early. The other type of meniscal surgery that is commonly performed is removal of torn meniscal tissue that was not amenable to repair. And certainly those patients who have very clear mechanical symptoms where the knee's locking and catching, and unfortunately if the meniscus cannot be repaired, it is often transformational to remove that unstable meniscal tissue, and patients can get back to their desired activity very quickly.